what you want, when you want it, where you want it. This is The Mesh.
Hello, and welcome to the caregiver community, where we are holding conversations about the challenges as well as the joys of caring for our aging parents and for ourselves. My name is Jane Everson, and I'm here with my co-host, Frances Hall. Hello, Frances.
Hello, Jane.
Frances and I are just two of the millions of adults in the United States, in fact, millions of adults worldwide, who are caring for our aging parents as well as for ourselves. Our guest today is Miss Annette Crombie. Hello, Annette.
Hi, Jane.
Annette has been an RN, a registered nurse, since 1984. She's mostly worked with adults and elders. Currently, Annette is the manager for the telemetry and intermediate care units at Fry Regional Hospital in Hickory, North Carolina. Annette recently completed a Master of Nursing degree in Education with a gerontology focus from Oregon Health and Science University. But in addition to her professional credentials and experiences, and I think more importantly for our caregiver community listeners, Annette and her family relocated to North Carolina in 2012 so that they could be closer to their extended family and to manage the care of Annette's mother.
Annette, we are delighted that you're here. Jane and I, and in fact you and I, have talked a lot about parents and aging parents and all of that sort of thing. But one of the things that I wonder is that as we watch television or read Annie magazines, we can't help but see all the advertisements for an assortment of drugs which seem frequently to be directed at persons who are aging. Is it almost compulsory? Does aging mean that we are going to have physical health issues?
That's a good question, Frances. I think that it's a common misconception among the public that aging just brings with it all those assortments of aches and pains, and we joke about it and that kind of thing. But normal, healthy aging doesn't necessarily have all those complications that we see. I think even in my own professional experience, I've kind of had a skewed experience because I've always worked in the hospital ever since I started out as a nurse. And so I've always seen sick people. I haven't necessarily seen those 90-year-old marathon runners or the people that are carrying their own golf clubs around the course. Those are not the people that I see in my daily activities. So I think that yes, we don't necessarily have to age that way.
So that whole thing of aging ain't for sissies, it isn't necessarily like that.
It doesn't necessarily have to be. I think that's very true. I think there's a lot of people out there that are physiologically healthy. There are certainly some normal changes that take place, some visual changes, for instance, that take place. Sometimes there are some hearing-related things that take place. But as long as someone keeps active, then I think that can do a lot to dispel some of those things. That being said, people are living longer than they did, even 10, 20, 30 years ago. I mean, we have people that are well up into their 80s and 90s. So the longer that we live, the more possible it is for us to have chronic conditions. And I think that's where you start hearing about all these health difficulties is in the chronic conditions that people develop over time.
I think.
Annette, what are some of the common medical and health conditions associated with aging?
I think some of the big three that we see are heart disease, stroke, and cancer in terms of things that are the biggest killers of elderly people. But there's other things that go into that. Breathing difficulties, COPD, diabetes is a huge one that we see, not just in elderly folks nowadays, but in the whole population. There's also things like increasing frailty as someone does get up into their 70s, 80s, 90s, if they live that long. Falls can become a problem. Depression can become a problem for people that's often unrecognized. And urinary incontinence is kind of one of those things that we don't always talk about, but that's something that's severely limiting for a lot of elderly folks too.
What about diabetes? You mentioned it. What are some of the general signs that adult children should be looking for when they're caregiving for a parent?
There's certainly some hallmark signs, and usually you can see an increased thirst, increased hunger, but there's also things like just fatigue and general weakness. And a lot of times in elders, you don't necessarily have those signs and symptoms. So that's one of the things that you would want to encourage your parent to go and be screened for it routinely, because a lot of people just have mild symptoms and they don't necessarily have anything show up that's alarming to them.
I think you also mentioned cardiac and heart problems as a common condition. What are some things that we should be on the lookout for that?
Heart problems, certainly sudden chest pain is one that we hear most often about. I think the general public is pretty well educated about that. When you have severe crushing chest pain, you want to call 911 certainly immediately. That's one of the main things. But people can also experience pain in other areas like their arms, their back, their jaw. Sometimes they can feel nauseated. They can be short of breath, break out in a cold sweat. Those are all kind of emergency type symptoms of a heart attack. But people can also have things that they can have chest pain with exercise, which can resolve after they rest, that kind of thing. But those are just some of the few things, and any one of those would be cause for concern for someone to talk with their doctor or call 911.
Mm-hmm. Is there a difference in what men would experience versus women?
That's a good question. Mm-hmm. I'm glad you brought that up, because actually February is Go Red for Women Month.
That's right.
Right. But yeah, sometimes women do experience the pain differently. They might not have that crushing chest pain where they feel like an elephant sitting on their chest, which is sometimes how men describe it. Women can certainly have that type of pain too. I don't want to make it seem like they could not have that sort of symptom, but women can also maybe just feel fatigued, or sometimes they'll come in with symptoms of the flu and they really actually did have a heart attack. People who have diabetes can also experience symptoms differently than the general public also. So just something to keep in mind.
You mentioned strokes as well. What are the symptoms of a stroke, and how are they similar and different from heart conditions?
A stroke, there's a mnemonic that I kind of like to use for that, and one that's taught by the Stroke Association, and it's FAST. And the immediate symptoms of a stroke will maybe present with facial drooping. So if somebody suddenly has the corners of one side of their mouth turned down, ask them to smile and look at the symmetry of their smile. One of their arms might be weaker than the other, so if you ask them to hold their arms up, one might drift away and down. And then their speech often is slurred, so you want to ask them to just say a simple sentence like, "You can't teach an old dog new tricks," or something of that nature, just a simple sentence, and test their speech ability. And if you do have someone, or you're with someone who's experiencing those sort of symptoms, time is of the essence. In other words, time is brain, and the sooner that you can get someone to care, the better. So you want to call 911 if someone's experiencing any of those symptoms also. There are some other symptoms of a stroke: sudden severe headache that's not explained, weakness that may resolve. Those are all kind of warning signs that you want to go ahead and get immediate attention for.
So it sounds like with especially cardiac problems and potential stroke problems, the real response is to get help as quickly as possible and not to hesitate to call 911.
Exactly.
I know with my aging parents, getting them to acknowledge that 911 is okay to call is really important. Any advice or guidelines on that?
It's tough, and especially when you talk to folks in the community, people don't want to call 911 sometimes because they think, especially those among the community who are uninsured or underinsured, it's tough because they know that's going to be a huge expense. But it's a life-saving thing. There's protocols that the more quickly we can reach someone who's having a heart attack or a stroke, we can prevent damage from being done, and we can save lives that way.
Can you speak a little to, you mentioned depression, and I just read an article that I think the title was something like, is it dementia or is it depression? Can you speak a little about depression and how it can manifest itself in the elderly?
And how it might differ from dementia.
Right.
Sure. Depression, I think a lot of times is just not recognized in elderly people, or sometimes it might be perceived that it's normal. And it's really not. Older people shouldn't be depressed any more than we should be. But I think sometimes it can manifest itself along with a medical illness, which there may be a good reason if you've just been given a difficult diagnosis. I mean, it'd be natural to be depressed if you've just gotten a cancer diagnosis or something of that nature.
Or maybe lost a spouse or other family
absolutely.
member.
Yes, as people experience loss, definitely there's reasons to be depressed, from an external environment standpoint, but a lot of times that can manifest itself as irritability or insomnia or fatigue, those kinds of things, as opposed to a dementia where that's going to be more of the person is confused or they're not really with it. Ordinarily with depression, people are not necessarily confused with that, although it can manifest itself as agitation sometimes as well, in addition to, extreme somnolence and that kind of thing.
Right.
I think you also said breathing problems. What should we be looking for with breathing problems?
Breathing problems can be very distressing to both the individual experiencing them and to caregivers or people that are watching it, because it's very hard to watch someone air hungry and trying to get a deep breath. But shortness of breath is one of the things that is going to present itself, and sometimes just increasing breathlessness over time. Coughing, a cough that doesn't resolve itself within a month is a chronic cough and should be investigated if it doesn't go away. Coughing up blood, increased phlegm production with or without a cough, even chest tightness or wheezing. Those are all things that can be signs of a respiratory or breathing problem.
And I assume that some of those are also symptomatic if you have heart problems or other kinds of maybe diabetes.
Yes, some of those things can go hand in hand. Mm-hmm. It's a good point. Heart disease can lead to breathing problems later on with heart failure and that kind of thing. So they do go hand in hand sometimes.
What about, you mentioned urinary incontinence, and I've also heard, and this may not be true, that sometimes in women, particularly urinary tract infections can present themselves as something that looks like dementia.
Yes, absolutely, and that's one of the first things that probably an ER nurse is going to look at if we get an elderly woman to come in, especially from a facility. If they have an indwelling catheter, it's one of the first things if they have a decreased level of consciousness or if they're just not quite acting like themselves. That's one of the first things that professionals and physicians are going to look at is to see, okay, do they have a urinary tract infection? Because it definitely can be one of the first signs, and they don't necessarily always have a fever with it. So sometimes the mental status changes are the first symptom that you might see.
Sort of along those lines, I was absolutely amazed recently, several years ago, to really see the impact of lack of oxygen and lack of hydration in an elderly person. I mean, it was just astounding the difference that particularly that combination made in the mental capacity, the reasoning, the understanding of what was happening around them.
Mm-hmm. Yeah, absolutely. If our brains are not getting enough oxygen, then mental status changes are really one of the first things that you'll see change. Mm-hmm. So it's definitely
And of course, if you're depressed or you're in pain, you're probably less likely to really take deep breaths or exercise or have enough nourishment.
Right. All those things can become a downhill spiral if we are not conscious of looking for them.
Well, I know we can't answer lots of specific health and medical issues without talking about individual people, but one of the things that we also hear a lot about, I think, recently is the use of the Internet and online health and medical resources. And I know I'm one of those people who's really guilty, or maybe it's a favorable aspect of, as soon as I hear a medication that my mother is on or I hear a diagnosis, I go right to the Internet and try to find out as much as I can about it. Is that something we should be doing?
Yes, absolutely. I think so. I mean, I think the better informed we are, the better job we can do taking care of our elderly parents. I mean, information is vital, I think. That being said, the internet's kind of a double-edged sword with that, because there's a lot of faulty information out there too, and things that are simply opinions that aren't necessarily good guidelines to look at. So usually what I try to do and what I would caution people is, when you're looking for information on the internet, I want to go to a reputable source. I want to go to the American Heart Association, for instance, or I'm not touting these organizations necessarily, but they present the evidence base that we have, the best science that we have to treat some of these diseases and conditions. So things, the American Lung Association and the Diabetic Association, those kinds of things. They all have official,
well-established nonprofits.
Well-established, yes. That they're disseminating information simply for the public, not because they're selling you a product. That's why I always try to look at, what are they trying to sell? If they're selling me something, then I want to be a little bit more wary of it. So I try to caution people, kind of go for the .org websites, which tend to tell you that they're a nonprofit organization, although it's not 100% true. Most of the time you'll get a little bit more reliable information. The thing that I caution, and things that I've learned from my own experience just in dealing with my elderly mother, be careful of forums, because they can be a great source of support. If you're looking for someone to connect with that is going through a similar situation, it can be helpful. Where can I find this particular product for my loved one, or that kind of a thing. It can be helpful in that respect. But there's a lot of people on these forums that sometimes are dispensing medical advice without a medical license, or sometimes they're giving you information about what happened with their particular case. It might not be relevant to your specific situation or your loved one. So I try to be really cautious about the forums and kind of take them with that proverbial grain of salt, and take the good information and sort of leave the extraneous information.
So get ourselves informed with the nonprofits, the .org sites, and take that information to our healthcare providers or our parents' healthcare providers.
Absolutely. And I think that taking that information and asking questions, saying, is this relevant to my mother's situation or my loved one's situation? And if they're not willing to answer those questions, then I probably would look for another provider, because I think that most providers are going to be open to that and glad that you're a smart healthcare consumer and that you want to do the right thing for your loved one.
Well, and I'm hearing in that even to have a healthcare provider that really is willing to dialogue with the patient as well as the family member who's the primary caregiver, that's really important. That's
certainly what I'm looking for when I go to a provider.
Agree. Agree.
We'll get back to your show in a moment. Just a reminder, you're listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Find out more at themesh.tv and give us feedback on what you like. And now, as promised, back to your show.
Kind of along those lines, we hear a lot about medications for our parents, for the elderly. And we hear all kinds of stories about people being over-medicated, under-medicated, the wrong medications, taking them at the wrong time, just this whole variety of issues surrounding medications. And sometimes it's because the loved one, the patient, himself or herself, doesn't take the medication properly or on time or in the right dosage, too much, too little, all of those kinds of things. What can you tell us? How can you guide us as the adult child caregiver for how to help our parents with that whole thing?
That is a whole can of worms too, Francis. And it can run the gamut. I just say the loved one forgets now and then to take their pills, or sometimes we end up seeing patients in the hospital who took too many of a particular medication, and they end up with us because we need to monitor them because of that. So yes, it can definitely be very serious, either underdosing or underdosing. I think one of the simplest things that we can do to help our family member is to make sure that they always have an updated list of the medications and the dosages that they're on. That way they can take that to all their providers so that all the providers that they see for whatever reason all know what that person is taking. Because I think
so, not just gather up all the pills and put them in a paper bag and dump them on the doctor's desk.
That is done, and in the absence of a list, yes, that's fine. I think that's reasonable, and it happens all the time. But I think it's a little bit more organized sometimes to have that complete list made out, because sometimes with the bottles, it may not be that the patient's taking that anymore. They may not have taken that for the last 6 months. So it's important to keep that list current, which is sometimes hard to do because people will start and stop taking their medications on their own sometimes for whatever reason. But having that list to kind of give to all the providers lets them know what other physicians have prescribed for them, so that they're not double dosing them on something or not giving them something that they need. That's for people who are able to really kind of manage their own medications for the most part. There are some people who, because of their memory problems, might need some additional assistance, perhaps with the little pill organizers that you could buy at a local pharmacy. If someone can fill those out for them, to put all their daily medications in it. If they don't have a very complicated regimen, then that might work okay for a lot of people, because then it's already there for them for the week. They know when to take their morning and afternoon pills. For other people, there are really fancy automated devices that will actually talk to the person and tell them that they need to take the pill, and then the person can silence the alarm after they've taken it. So it kind of monitors it for them. If they're in their own home and they don't have anybody really to supervise them, the machine can do a little bit of that supervision. But then there does come a time for lots of people where that's not enough either, and they do need someone to really keep more tabs on that. And that might be you as the caregiver, or a professional person, either a medication aide or a nurse, to do that. And I have mentioned to Frances and talked with her about that. That's one of the main reasons why we moved my mother here, because even though she was a nurse for over 50 years, she got to the point where she couldn't remember whether she had taken her medication or not, or whether she had taken it twice or however many times. And so that was a concern for us. And so that was one of the things that made our decision to bring her up here and have her in a facility where she can have that monitored 24/7. I
imagine that allows her to have a great deal of independence, because she and you don't have to worry about the medication, and she can still enjoy some of the other activities she enjoys.
Exactly. Although I have to tell you that she has fought that a little bit, and even now it's been a year and a half, and I still sometimes find little pill caddies stashed around her apartment. So she hasn't kind of given up on that idea of medicating herself. I guess that's it's kind of a hard thing to break for people.
Well, that's part of that loss that they experience. Yeah, I want to go sort of on the backside too of this medication idea concept, because when I go with my mother to appointments, I now have a list not only of her medications, but also the medicines that she has taken that she has had some sort of a reaction to, an allergy to, and exactly what happened. So when they say, oh, well, we want to prescribe X, I can say, ooh, let me look at the list, and be able to tell them, well, when we do that, when she takes that, this is what happens. And that has been really helpful to have that information also at hand.
Yeah, that is a wonderful idea, because just saying that you're allergic to something doesn't always tell the whole picture.
Right.
It is helpful to be able to tell the provider, well, it causes this reaction, or this is what happens. So that's a wonderful idea.
A lot of what we're talking about today, I think, is balancing the roles that we have as adult child caregivers, and giving the respect to our parents who may still be in a position to want to and to need to and be able to take some control over their health and medical issues. How do we balance those roles, and when are some times that we need to jump in, and when are some times we need to just step back and let them take charge?
That's a tough question, Jane. I struggle with that one on a daily basis sometimes, just because you do want to allow your parent to have as much control as possible, and I think I've mentioned to Frances before in conversation that when we moved my mother up here, she lost the ability to live in her own home. She lost the ability to drive. We sold her car. She lost the ability to manage her own medications, to choose what she was going to eat for lunch. All those things are losses. And right now, my brother and I are sort of struggling with whether or not we need to intervene with her financial matters, because she's done a few questionable things that are concerning to us. And so, that's kind of the last bastion for her at this point, has been managing her checkbook and managing those things. And so I really hesitate sometimes to step in and do that. But I think the governing thought to me is keeping her safe. And so
My mantra.
Yes, I think Frances mentioned that in the previous podcast. But yes, it's like I have to do what I need to do to make sure she's safe, even if it makes her mad, or even if it's not what she wants. I think what my brother and I have tried to do from the start is talk to her about things first and not make decisions without her input, because she still does have opinions, and she does want to give us that input. And so we encourage that, and we can't always go along necessarily with what she wants to do, but at least we've given her the ability to voice her concerns or what she wants to do.
And that's so important, because they still are people, and they still really do have those perspectives, and it is incumbent on us to be as respectful as possible, regardless of what the circumstances are.
And respect that everybody has a different opinion on how active they want their treatment to be, or how much they want somebody else involved in not only the diagnosis, but the decision making about next steps.
Absolutely. I think that makes me think of an example. When my mother was still in Florida, she had experienced some issues that made her provider want to do a bone marrow biopsy for her. And she, being a nurse, she understands that that's a very painful procedure, and she also questioned what they were going to do with the results of that procedure. And she said, well, I'm not going to take whatever treatment it is that they would do if they found that something was amiss, so why should I have it done? Which, of course, is a very valid point. So they really tried to pressure her a great deal to have this procedure, and she's of the generation that is respectful to physicians and providers, and she wants to be cooperative as a patient, but she did hold the line with that one, and I supported that fully, because people should have the right to make that decision, and and elders, even if they're confused and even demented sometimes, they still can say, no, I don't want you to stick me, or I don't want that to happen. So I think we do have to be respectful of that.
Absolutely.
Annette, you've had a very interesting journey, both because you're a medical professional and your mom is a medical professional. Are there any words of wisdom or lessons learned that you'd like to share with us and other caregivers? Things you wish you knew before you started this journey?
Well, I think I wish I had known more about the legal aspects of what it takes to become a power of attorney, or to have some of those conversations before we actually have had to have those conversations. I think that's one of the things that I would definitely try to encourage people, is to have conversations with your loved one about what they want if they become incapacitated, and then you're not left guessing. That was one of the blessings for me. My mother did know very adamantly what she did want and what she didn't want. So at this point in time, if something happens, I don't have to guess what she wants in those situations, because she filled out her paperwork years and years ago. But I think that's one of the things that I would encourage other people to do, and that I've learned is learn about insurance, learn about Medicare, do some research about some of those things, because that's not something that nurses know. That's not part of our repertoire, really. I mean, that's the billing department, and it's not something that I had any awareness of. And so that's one of the things that it becomes very important once you start to navigate things for and advocate for your loved one is to be able to deal with insurance companies and all that kind of information.
And I think one of the things you're saying through that is that regardless of our background, regardless of what the journey has been, there are always areas that we're not going to know. And it really is helpful for us to sort of have an idea, an overview, if you will. And what are the areas that we're really competent in? What do we really know? And what are those areas that we don't know? And go find out.
Exactly, and I think that makes me think that I believe the first ACAP meeting that I went to was about the legal and financial and that sort of information, because that was where I was lacking, and that's what filled a need for me definitely in learning about that. I was new to North Carolina. The law here in this state is different from other places. It just kind of behooves us to understand what we need to know about estates, and just it allows you to take care of your loved one by knowing those pieces of information.
That's right. That's right.
All good information, and certainly some potential topics for upcoming episodes, it sounds like. Annette, thank you very much for being with us here today, and thank you for listening to the caregiver community. Frances and I hope you have enjoyed, and most importantly, we hope you've learned something today about caregiving and caregivers. This program is part of the MESH network of online shows and podcasts. You may learn more about the MESH, and that's MESH, and check out the other programs available for free at www.themesh.tv. On that site, you may also send us a suggestion or a recommendation for future show topics using the Contact Us button. We also hope that you will look for us on Apple iTunes, where you may subscribe to our show and make sure you receive all future episodes sent to you automatically. You'll find a link to the MESH website or our ACAP website to subscribe. Frances, Annette has talked about ACAP Community. Can you tell people where to go for more information on ACAP Community?
Yes, that was quite a segue. Thank you for that. Yes, ACAP Community, you can find out more about ACAP at our website, www.acap, and that's AC as in cat, AP as in Paul, acapcommunity.com. Or you can go to our Facebook page, ACAP Community, and please like us so you can continue to get all kinds of information. You can also email us at info@acapcommunity.com, or you can call us toll-free at 877-599-ACAP or 877-599-2227.
Thank you.
Thank you so much, and thank you, Annette.
Thank you.
You've been listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Check us out online at themesh.tv. Discover other network shows and give us feedback on what you just heard.